Hi, Nursing 6818, Dr. Kim Paxton. Today we're going to be starting week number 4. This week we're going to be looking at lifestyle and disease mediators. These lead into the risk of disease development. So, understanding how individuals interact within their social environments, their built environments, the choices that they make, and how these choices related to nutrition, exercise, stress management, spirituality, engagement, all of these elements interplay into the development of diseases. So let's head into our week. Our objectives this week are actually for some of you going into elements that you may have learned in your undergraduate program. Now we're going to take them and elevate them into how I, as a nurse practitioner, need to be listening to my patient and assessing my patient for these elements. So we have our 6 outcomes for the course, which are formulated into 3 personal understanding points. From this module, you are going to be able to develop an understanding of how the correct exercise prescription, and this is getting the understanding of that physical activity and exercise are not the same thing, and beginning to get an underlayment of the different elements related to exercise, the aerobic, resistance, strength, flexibility, balance training. All of these are different, and each of them targets an element of our health. Now, you need to understand what exercise is and how exercise is an integral part of prescription when it comes to interventions for health promotion, because this is an element that is actually not being done in healthcare, and nurse practitioners can be held legally responsible for this understanding and how they translate it to their patients. You see, by engaging in the right type of exercise, we can actually reverse the development of chronic disease states, and we can actually prevent different disease states from happening. The second thing you're going to be able to do after going through this module is define the difference between being overweight and obese. Now, there's a significant difference between the two, and each of them carries their own set of risks. And that pathophysiology of risk leads into other disease states. Remember that adipose tissue and the development of it is not a healthy factor related to human longevity. And the book readings this week are really going to help give you a greater understanding of this. The third element is really getting a stronger understanding of the relationship between diet and exercise. And most of you may be thinking, I've got this, I understand this, or I'm practicing this. I need you to be able to translate your personal knowledge and your new learned knowledge into language that patients are able to understand. Because a lot of times we talk to our patients, but the way we talk to them doesn't necessarily translate. I had you guys give a reflection in one of your discussions in week number 2 in relationship to talk of a moment where you may or may not have had a healthcare provider not listening to what you're saying. And several of you brought forward some very strong reflections. Well, that's what I don't want patients to do about you. So these are our objectives for this week. The readings that you're going to be engaging in will help define this out for you and help you get a stronger base of understanding. So moving on to the readings, most of your readings this week are in Rotman and LaFontaine. There are 4 chapters that I'm asking you to read, and I'm asking you to read them with an open mind. Those of you that work in cardiology or possibly in intensive cares, the relationship of atherosclerosis and other vascular disease development, you probably have a really nice, strong pathophysiological understanding. I want to take that to the level of, so how does this mediate into disease processes? What does this really cause? You know it causes heart disease, but what does it actually do? And how does it mediate the development of other diseases that occur? And there's an interrelationship among all 4 of the different types of reading that you're doing this week between the atherosclerosis, the overweight and obesity, the type 2 diabetes, and the hypertension. There is an underlying pathophysiologic process that mediates and starts all of these. And it's actually embedded in the article I'm asking you to read by Calder, and that's inflammation. You see, by gaining a deeper understanding of what underlies the entire disease development phase, not taking into account genetics, but just lifestyle, and how we modify lifestyle, we can actually attack some of the elements that we introduce into our genetics and work to alter them by not staying healthy and following dynamical guidelines related to lifestyle. We actually mediate genetic alterations and change lifestyle and cause diseases. So I'm hoping that you'll find the reading this week really helpful to you. As you're reading over what I've provided you and you're gaining and taking away your personal pieces to enlighten and expand your personal knowledge, keep in mind how can you apply some of the elements that you're reading to yourself personally. And remember, our self-care and what we do for ourselves as nurses is how we translate information to our patients. We do have a unconscious personal bias that we will bring into play. And so learning how to help yourself as well as learning how to apply these to your patients is really important to do, because a patient will ask you, so how did you overcome this? Or have you ever been up against something like this? And I've seen and been with providers that have never really done it, and they lie to the patients, and you can see on the patient's face that they're not getting what I'm saying. So I've got a great quote for you today. Focus on what you want your life to look like, not just your body. This is a transformational lifestyle change that we're going to ask our patients to do a lot of times. And we have to remember that it's more than just change your diet, start exercising. It's a lot more than that. And so as we begin to integrate with them, we really need to make sure that we are communicating that we have this understanding. We're going to go into chronic disease this week, and you have some elements that you're going to be reviewing over. So on this particular page, it's looking at the chronic disease development and the unhealthy lifestyles that people engage in and the unhealthy built health environments that impact into these a little bit tighter. So I've got two articles that you're just going to do a brief review on. The first one is by Simmons, and the other one is the biological mechanisms underlying role of physical fitness, health, and resilience. That is a great article. That is such a good article. As you move down and you read over these, I'm asking you just to do personal reflection in your mind, but then you're going to be moving into step number 3 at the bottom of the page, which says access this web link. What's the risk? This is a really interesting online tool that patients can utilize and that healthcare providers can refer their patients to actually do an in-depth risk assessment. They then get a printout that they can bring to their care provider's office. There is also an opportunity when this particular assessment is completed that it can actually be sent to the healthcare provider. I want you to look at this, one, from the patient perspective, you being the patient, and only you are going to see your results. It doesn't ask you for a lot of personal information. The only thing it asks you for is a zip code. So in essence, you're actually going to be engaging in a type of research, if you will, because they are collecting data off the zip codes. But it can't be connected back to you. It asks for your name. Just put your first name or make up a name. You don't have to use your real thing. And then start answering the questions and answer them for the whole heart. So, how well are you? How healthy is your lifestyle? And is there anything that you can do to improve it? In school, I know is going to be a stressor, and you'll probably identify that, but there may be some other elements that may interplay in that you may not be aware of. I also want you to look at it from the eye of understanding and literacy. And I want you to look at some of the symbols that are used, some of the terminology that is used, and is it simple? Is it understandable? Do some of the things that they do actually promote understanding? Or from your perspective, do they actually maybe impede understanding because there's conflict occurring between what you're seeing and what you're trying to interpret with words. So kind of take a look at it from that way. What you're going to be engaging in this what's the risk, there will be questions on a quiz this week that are related to this. So if you do not engage in what's the risk, you're not going to be able to answer those questions appropriately. So it took me probably about maybe 15 minutes, maybe 20 at the most, to do this risk. I've done it a couple of times because they have made some adjustments to it. I think it's a great tool. And the third thing I want you to think about as you use this tool is this something that you could refer your patients to, that it would help cut down on the amount of time that you spend asking all these questions because the patient has been able to answer these questions externally. Just a thought to place inside your heads. Your quiz this week is going to relate to your readings in Rotman and La Fontaine, these 4 chapters. It is a multiple choice related to those quiz questions. You do have 120 minutes. That's 2 hours to take 13 questions. Now, I will be straight up with you. If you're not reading the chapters, you're not going to be able to answer the questions. And the reason that you have 120 minutes is some of these questions are deep thinking or deep critical reasoning questions, and you may need to refer to your book as you're answering them because you may not remember. And I'm just being straightforward with you. These are not easy questions. For some of you, the way this content is being taught to you is very foreign. It may feel foreign. It's not sticking with the way you are and who you are. And for that reason, it may be a little bit more complex for some individuals versus another. You do have 3 attempts to actually take this assessment, and only the maximum points will be recorded in the grade book at the end. This week is the week that you'll be turning in one of your large papers, and this is the first of 2 in this particular course. This is your health promotion and risk assessment paper. I began talking you and prepping you last week related to this assignment. APA is going to be graded on this assignment. In review of what you turned in last week, there was some significant improvement in relationship to APA use and formatting. Please remember that on the title page, the running head is written in a specific way, and I'm asking you to please look at your APA books and the example they give you in your APA books to write a correct title page. You do need to use a title page with this assignment, and they do need to be correctly page numbered. You do have to use headings for this paper. The headings I have bolded after the process piece. So your headings for this paper would be genomic influences, social determinants, lifespan considerations, complex health systems, exercise nutrition, and then a conclusionary paragraph. This entire assessment or assignment, if you will, is based off of a case scenario, which is in our gorgeous little spring green to the right. Alex is quite the individual, as some of you have already found out, and he really is in need of your assistance. So that is the scenario, and that is the information. Do not make up information if you don't find it present, and do not add anything beyond what is written in the case study. In other words, I don't want you making up information. Just use what you have in his case scenario to begin development of his plan. Each of the elements of this assignment are taking aspects of learning that you have learned in these first 4 weeks and seeing how you are able to translate them into knowledge for your use and then translate them into action and plan of care for a patient. And Alex is our patient. As a nurse practitioner, I need to be able to understand those genomic influences which come from the health history of the family that you get from your patients. So understanding this is what my present medical problems are, and these were the medical issues that I knew existed in my family, help you gain a picture of the genomic influences. I'm asking you to please look at elements of depression and what's the hereditary risk of developing depression along with these genomic influences. The third one are the social determinants. You'll be reading over this scenario and looking at the environmental, his cultural aspects, the safety factors and risks that actually mediate into self-care. And from reading this scenario related to Alex, what are you identifying that are issues that are present that you may be able to help him with? The fourth one is lifespan considerations, looking at his gender, looking at his age, and factoring into this, how would you begin looking at a health promotion plan for him? So the bullets are saying specifically identify and discuss functional problems, and this goes back to Gordon's functional health patterns that you had read about in the last class. And from that, moving into elements of assessing out of the case scenario. I'm asking you to identify two ways that you may be able to work with Alex in relationship to what you identify as these functional deviations. The bulleted blue, make sure to discuss how depression can adversely affect a health promotion plan and identify at least one intervention to assist with motivating that individual who has depression to try and engage in healthy lifestyles. The complex health system one, this is looking at more of that bigger picture, that social picture, and that built environment that affects. You can choose just one element out of the ones that I have in parentheses to address, or if you choose to, you can address more than that. But please make sure you're looking at how these complex systems impact quality and patient safety initiatives. Remember that safety initiatives aren't just about I'm going to fall and possibly break a leg. It's about the safety of my also engagement of wanting to keep myself healthy, of wanting to do safe care practices. I want to not drink 6 sodas and I'm going to drink 6 glasses of water, how the environment can impact that kind of mentality. So you can look at it from that perspective too. This is a very broad category, so how you attack it is completely up to you, but I have to be able to see the connection of whatever you choose to do related to the complex system and how working with that or having Alex understand how that impacts him can be brought forward. The last one is exercise and nutrition, and this is related to how you're assessing him in the elements above. So based upon your assessment of him, I want to see how you would develop interventions of exercise and nutrition modification. And remember, Rotman and LaFontaine helps you understand the different types of exercise. It also helps you understand how nutrition and types of nutrition interplay into this and how this can actually work to help improve his health. As you're looking at these and writing these, I want you to make sure that you're citing information and not just going off, well, this is my belief. I don't want your belief. I want it evidence-based. So you're going to need to turn to the literature. You can use definitely your textbooks and cite your textbooks, but you need to be turning to the literature and using the literature to help support your statements of, I would, in his plan, do X, Y, and Z. Well, in X, Y, and Z, what's the evidence that says this is the best way to actually work with this in relationship to Alex? I want you to identify barriers that you have to plan for in relationship to what you know about him. And then I want you to write a paragraph that shows me how you would discuss this topics with him in the case. This isn't written from you and I talking in a professional conversation. This is you talking to Alex in the office. He's resistant. He is distracted. He's not understanding. You need to break down the medical jargon and the medical terminology and give this to Alex in a way that he's able to understand it and interpret it in a way that's meaningful to him. And your ability to determine what's meaningful to him is embedded inside this scenario from what's presented and the way he's answered statements. I don't want this written as two professionals talking. I want this written in the perspective of you sitting in the office and talking with Alex. The last one is your conclusion, and this is a paragraph that indicates your intentions of your health plan. you can actually start this off with a sentence, and then if it's easier for you, you can use bullets and bullet out, okay, this is my plan for Alex, and I would start with, this, I would go to this, and then make sure it's realistic, it's centered on Alex's need. It indicates follow-up of what time frame you're going to give him to begin enacting some of these. And it can be in two parts. So this is what I want Alex to do now, and here's what I'm looking at for the future. Remember that humans can only make so much change so fast, and if you put the earth in there for relationship to what you want him to change, he's not going to be able to change it because we can't make six changes all at once. It's going to set us up for failure. With this assignment, you are going to need a reference page. Remember that the reference page is a separate page from the actual content that you've written of, and that only the elements that you actually cite in your paper go on the reference page. Remember that on the reference page, one of the things that I saw coming across on several of the assignments from last week was that there was not double spacing occurring on the reference page. Remember that with the reference page, that the first line of the reference is going to be flush left, and then the second line is indented that half inch, and it's double spaced between the two lines. In your APA book, it illustrates this very clearly for you on the example. It also discusses it when you talk about how to write a reference page in that particular chapter of your APA book. There's also a lot of references that you can use online to actually make sure that you're writing correct APA. The citing of websites I also noticed to be a little bit of a complex component for you. I'm asking that you please go online to the APA by Purdue OWL and look at how to cite a website in the context of your paper properly. You don't put the entire URL as the citation inside the paper. You use a part of the actual web page title, or the title of whatever it is you're looking up, and it explains how to do that more clearly. As you're moving through this course and you're going to head into other courses, it's going to be important for you to know how to cite these websites, as we use them frequently. And if you're heading into your DNP or PhD, they aren't going to tolerate any imperfections in relationship to APA formatting. So working with you here and helping you guys get a good foundation of this. As you're working through writing this paper, if you have any questions or you're not understanding an element that I'm asking you to write upon, please don't hesitate to put it up underneath the module, I've got questions in the class, or you can email me via Canvas mail. Be happy to answer your questions. Please don't wait till the last minute though to start this paper. It is going to take you quite a bit of time to write. That's why this week's assignments for classwork are a little bit less, because this is going to take time. Also, in order for you to get maximum points for this paper, you are going to need to be using references in each of these sections that you are writing upon, and the rubric clearly explains how to get that exceptional versus the proficient grade. This week I'll be leaving you with the inspiration. Productivity is never an accident. It is always the result of a commitment to excellence, intelligent planning, and focused effort. You're going to be employing this week as you write this paper. But if you think about it, this quote actually works in the same way of what you're trying to do for Alex. It also works for ourselves in us trying to engage in self-care and keeping ourselves healthy. And my final inspirational point: healthy is an outfit that looks different on everybody, so the same plan won't work for every patient. Have a great week. See you online virtually.